Brooklyn Independent Television.
What if you're injured and you need physical therapy, but you're in such discomfort that you have trouble even standing, much less walking or using weight machines? The answer, as Healthbeat Sherry Carabin found out in Park Slope, is water.
Too easy?
It's a little easy.
No pain, right?
These are the images most of us associate with physical therapy. But not everyone is healthy enough to use these machines, lift weights, or even do traditional stretching exercises.
I've been having a lot of pain with my left elbow.
A few years ago, Bay Ridge resident Marco Alicea was in a serious accident, which left him with multiple injuries.
I have herniated discs down my spine. I have damaged both elbows. I have pain in my wrists, my knees. I have damage in both hips, both ankles.
He's had several surgeries since the accident, but it's still difficult for him to stand for long periods of time or perform other tasks necessary for traditional physical therapy. That's why those at Metro Sports Med recommended aquatic therapy.
It's a bathtub with a treadmill underneath. We generally set it to about 98, 99 degrees at a time. So you want it as close to body temperature as possible without it being too warm, because as soon as they start doing the exercises, it'll really start to heat up. What's that for? It's just to warm up the neck. It's just a heat pack. Basically, what we're trying to do is unweight the joints so that it's not as much pressure for him and it's not as painful for him when he's doing exercises. And that's really what the benefits of the water therapy. It takes a lot of the weight off of the spine so that he can move around a little bit easier. When you're taking that step back, try to keep your back a little bit straighter as you come down.
Metro Sports Med has multiple locations in Brooklyn and one in Manhattan, where they have outpatient care and rehabilitation for various types of problems. A few also offer aquatic therapy using the Aqua. Alicea has been coming to this location at 263 7th Avenue for about 3 months.
It's the best warm bath one can possibly get. You get to exercise at almost half your weight. That's what makes it simpler to exercise in my lower extremities.
How long has this machine been around?
Over 10 years or so, but it's only gotten very popular over the last 5 years.
How do you decide who's a good candidate for aqua therapy?
Basically, we look at a patient's history. We see if it's a chronic type of issue or if they can really tolerate what we call land-based treatment, which is treatment outside of the water. So we look at if they have had a recent surgery and just really aren't able to tolerate any weight bearing on a lower extremity, for example, a knee, an ankle, a hip, whatever have you. And then we see would aqua therapy really help them? Would they be able to perform a little bit better after they come out of the Aquasizer in the land-based therapy? We have had children be recommended for the Aquasizer. The youngest that I've seen go in was about 6 years old, and we have the ability to change the height of the waters, so obviously it won't be as full as it would be for a normal adult. Ready to take a break?
The Aquasizer is also used by athletes who are training for competitions.
Generally, athletes can get a very good workout from the resistance that the water provides. It resists them throughout the entire movement.
That was it.
Okay. So I'm going to turn the jets off.
But in Alicea's case, his goals are much more basic. He wants to avoid additional surgery while making as much progress as possible.
Every day that I can get a little less pain is great, and the aqua therapy helps a lot.
For Healthbeat Brooklyn, I'm Sherry Carabin.
Watch this and other Brooklyn Independent Television episodes online at brickartsmedia.org/BIT.